Psychologically addictive in the sense that people like it and want to do it again. This is much different than alcohol. But certainly cigarettes are more addictive than marijuana. And since cigarettes are physically addictive and yet legal, should addictiveness really be a barometer for a substance's illegality? No. It is a myth that marijuana use can cause schizophrenia. According to Dr. Lester Grinspoon, Associate Professor of Psychiatry at the Harvard Medical School and author of Marijuana Reconsidered, marijuana laws and their enforcement have become increasingly severe, buttressed by new myths dressed in scientific costumes, such as the present notion, developed largely in England and Australia, that marijuana causes schizophrenia. Marijuana has many confirmed medicinal uses. It was widely used to treat glaucoma, give relief to chemotherapy respirants, and also as a treatment for any psychological disorders, such as social anxiety disorder and anxiety disorders. Additionally, there is no contention in any medical circle that marijuana is an effective stress reliever, causing it to have immeasurable beneficial effects in the treatment of stress-related physical and psychological disorders. Yet many state governments have banned even the medical use of marijuana solely because it potentially makes it more available to illicit users. There are several studies that not only discount marijuana as a cause of schizophrenia, but further suggest that it has sometimes profound beneficial effects on patients with ADD, borderline personality disorder, and schizophrenia. Marijuana has been used in religious rites and rituals for thousands of years. If venomous snakes in religious rites and rituals cannot be banned in this country, which the Supreme Court decided is constitutionally protected, then what right does the government have to prohibit the use of an obviously less deadly practice, such as the consumption of marijuana? It is for every person alone to decide what is spiritually beneficial to them. Our First Amendment guarantees it. My second point is that marijuana is not a gateway drug. There is little evidence that marijuana is a gateway drug. If marijuana was a gateway drug, you would expect to see high numbers of marijuana consumers also being, for instance, cocaine users. But this correlation does not really exist. In America, for every roughly 100 marijuana users, there is only one cocaine user. In addition, it is nearly impossible to establish a direct causal link between an individual's marijuana consumption and their subsequent hard drug consumption. It is completely possible, for instance, that individuals who choose to partake in marijuana consumption are inherently more risk-taking. Therefore, their choice to try cocaine could be completely causally dissociated from their initial consumption of marijuana. Some may argue marijuana may be a gateway drug because it is in the drug black market. Marijuana is often criticized as being a gateway drug to harder drugs, and this is used as a justification for its illegality. Irrespective of a lack of evidence in this regard, there is reason to believe that marijuana's illegality itself could be the cause of marijuana being a gateway drug.